I'm all over the place.
Oh, I've heard about you. You're the librarian, right? Oh, your reputation precedes you. Yeah.
I'm not sure how many of you made it so you could see the new space, but I'm glad you did for whatever reason. My name is Leary. I'm the Executive Director of the Prouty Center and a Commissioner on the Blue Ribbon Commission. This is the host of, which is the host of this forum. The Blue Ribbon Commission is about a year old. The governor and the legislature put it in place to study high quality, affordable childcare in Vermont. And what that has meant is that there's a group of commissioners that represent a broad diversity of the field. Probably not broad enough, but that's how it goes. And getting together to talk about what is quality, what is affordable, what's in place right now, and the ultimate goal is to make recommendations to the governor and the legislature about what Vermont can do to make sure all Vermonters have access to high quality, affordable childcare. So that's the big dream. We've been meeting monthly to talk of various different things, defining quality or looking at definitions of quality, looking at other systems of care and how we might consider those as models for what we want to do, looking at other elements of early childhood, the public pre-K, how that impacts the early care and education world. So different topics each month, gathering information and data so that we can put out a report in November, which is, you know, really soon. So this part of gathering data is about hearing from the community, specifically on 3 questions. The commissioners we came up as a group with these questions to try to get a sense from communities about what's going on. So one of the exciting things about the Blue Ribbon Commission, this one, is that there are private funders who are helping staff or have created funds to let a consulting group help us write that report, which is why I'm actually optimistic that it will get done. So actually Zane is here from PCG Consulting. They've done a lot of work in early childhood and funding early childhood, so we are in good hands in that way, and we're excited to sort of see what comes of it. So that's the broad picture of the Blue Ribbon Commission, why we're here for this community forum. So what we are wanting to do, I know many of you probably saw the flyer. What we'd like to do in this evening is for everybody to get to weigh in on the 3 questions. So you're in 3 groups, and this is modified World Cafe style. So the 3 questions that you may have noticed on the flyer are: how could we make high quality childcare more affordable in Vermont? What should Vermont's responsibilities be in helping to ensure all Vermonters have access to high quality? And what would help you or others access high quality childcare? So 3 pretty broad questions to weigh in on, and our hope is that there can be lots of input from different areas, that it's not, hopefully these are not limiting questions, I guess is what I would offer. I will pass out questions and we can get started. Thank you.
And I know most of you. I don't think I've met you before. Terrific. I'm glad you did introductions. I stay. Here's your question. Okay. I'll get your pen. Oh, I got one. I stole one from Sue. Thank you.
And I am a volunteer with United Way.
Grew up in New Jersey, summer months. My name is Diana Gibson. I'm a former early childhood educator.
And I am Sandy Stark, and I coordinate the Welcome Baby program.
Working at the moment with Ellie and Dunham on their project, and also have other projects we've done.
Access to high quality care.
I think raising the income level, I mean, it's a joint responsibility.
People who took notes to do is to think of 1 or 2 sentences that captures maybe the highest level essence of what rose to the top for all 3 groups, if you could.
So what would help you or others access high quality childcare? So all three groups hit on flexibility as really key, that both providers and employers needed to be more flexible in having family supporting policies and procedures. Transportation was a huge issue across the board. And then cost. So how we pay for childcare, how we incentivize or disincentivize families going to work or not going to work, plays in the mix as well. So that was a key piece. And we actually, all three groups ended up talking a lot about how to support families outside of a childcare system. So how do we build connections, networks, community among families, and that was a piece that was missing that is often sort of put in place when they have a sort of a set childcare facility, but that building those connections and networks was really an important part of sustaining a family and children. And so maybe accessing high quality childcare wasn't the end the end game. It was how do we build strong, resilient children ready for life, So we ended up talking about other things.
So what should Vermont's responsibilities be in helping to ensure all Vermonters have access to high quality care? In all the groups, we took this in a couple different ways. We looked at the state of Vermont, the state government's responsibility in ensuring that all Vermonters have access to high quality care, as well as just Vermonters in general, citizens of the state. What was their responsibility in ensuring that Vermonters had access? So there was definitely a lot of talk about changing the subsidy level so more people were able to access subsidies. A lot of talk about incentives, incentives for businesses to have on-site childcare, incentives for people to open early education facilities because there wasn't enough early child care provided. There was also talk of a lot of talk of paid parent leave. That was a big part of our discussion, especially in the first year. Basically, again, the state or just our society valuing those early years so that parents could stay home, particularly in the first year or 2 years of their child's life, and keep their job and have the money in order to be able to do that. That was actually, I think, came up in all three groups today. And another thing that came up a lot was a shift in mindset. Really, for us as Vermonters and just us as a society, should really be looking at the importance of children and really making children a priority, and not just our own children, but looking at all children. And we're all in this together, and we should all be trying to help all children, so that and for a lot of different reasons. Part of it, they're going to be taking care of us later on. Part of it, it's going to help reduce prison costs later on. And part of it is just, as a society, we should be caring for our own children.
Our question, a lot of the themes that came up in the what Sue and Sandy have talked about also came up in ours. So our question that this table discussed was how could we make high quality childcare more affordable in Vermont? So it was more focused on affordability. So we had several themes that we talked about. We really ended up talking a lot about the return on investment, how investing, looking at it through an economic lens, how investing early, how supporting children and families early on in life in those first few years really provides a lot of value to our communities and to our society later on in life. So we talked a lot about how investing early will decrease cost associated with drug use, with prison, or with incarceration. We also looked at the role states can play in financing that and funding that. So looking at other models that we have used or maybe other countries have used. So in this state, we looked at how the state system incentivized the training and education of healthcare providers, so dentists, and other healthcare professionals. We also talked about Dr. Dinosaur and the state saying that health of children is so important that we're going to create a program to ensure that all children have health care. So I think the third thing is then looking at the affordability for everyone. So one of the first questions that was asked when our group came together was affordable for whom? And so really broadening the question to include both the field, folks, businesses, organizations, staff that are providing care and education for our children, and ensuring that they are paid a wage that compensates them for what they're doing fairly and equitably. And then also on the other side for the parents and the caregivers to ensure that they're able to afford high quality programming. And so making sure that when we talk about affordability that we're talking about affordability across that spectrum. And finally, I think something that came up in all three of the groups is really looking at this in terms of radical change is needed. This can't be just an incremental Vermont only issue. There has to be a national resolution to this. So we didn't really have, I don't think anyone came up with an answer, but we do have other models, other states like New Jersey, other countries that have models in place that look at of paying for high quality and being able to do it in a way that works.
What happen with the notes is we will give them to PCG. They will incorporate them into their report. So have no fear. All the comments somehow will get in there. I'm struck by listening to the report out, the crossover between the questions and how, you know, I think what I'll take back with me to as I reflect at our commission meeting about this is how interrelated these are, and were these the right questions? Are there other questions we need to ask? So it's really great to hear sort of the crossover because it helped me reflect on, there's something else we might need to keep asking about here. So thank you for that. So I want to give folks an opportunity to make an individual statement. If there's something you didn't get to say or you want to repeat or reiterate for the record, so to speak. Again, we're videotaping, so that's another piece of data. If anybody, this would be a chance to take the microphone and say your name and make a statement about anything. It doesn't have to be about one of these questions. It could be about anything related to, anything related to this topic. Sorry, I didn't mean to open that can of worms, but anything related to sort of high quality, affordable, accessible childcare and the issues we've been talking about tonight.
Oh, I think 2 minutes is adequate. So most of what I stated was made at the three tables, and I think I probably was at the table with 80% of the people who are here, and they heard my comments. And as I'm sitting over there listening to the summaries, the first thing that comes to mind is that all of my statements were ignored by all three summaries. So that's sort of disheartening that I showed up as sort of an opposing viewpoint, made statements at every table about the financial part of this, and none of it was captured in the summary, which is not unexpected, I suppose. It's human nature. This was sort of a downer. This individual who states that he's representing the taxpayer is very concerned about people without children getting hit up to fund all of these early child care programs or later in life child care programs. That has been my statement all along. At every table, and that didn't make the summary. So given this opportunity, I'll reiterate. I don't feel that on top of funding all of your children's K through 12 education, that you're also going to come to me and ask me to subsidize childcare. I'm a big advocate of childcare, and the structure and the benefits are easily recognizable. The question is, who's responsible for paying for it? Are those of us without children responsible for picking up the tab for all the parents? As I stated in a summary, I'm one of 8 children, lower middle income, no early child care. All 8 children have college degrees. There are no problems. They're all successful. What happened? They didn't benefit from all this. And somebody said, well, you had a stay-at-home mother. And I said, yes, I did. I had a stay-at-home mother, which resulted in There's a bicycle, there's the playground, there's the neighborhood, have at it. That was what the structure was. So I just wanted to make sure that my viewpoint made the record. Thank you.
My name is Thera Fuller, and I wear multiple hats. I have a child in public education who also accesses some programs for after school, and we used a preschool program also when she was young, and I believe there was a subsidy for that through the town of Putney, which I appreciated. I also, as a professional, represent the expanded learning programs for Wyndham Central Supervisory, which is the summer camp programs and the programs before and after school. So there are two things that I hope to have on the record. One is that I wanted to make sure that this discussion did include some long-range thinking, even though I know primarily we're talking about up till children go to kindergarten, but we have a huge need for supporting kids all the way through because there is significant research about the vulnerability of kids in the period between 3 and 5 in the afternoon, because most families need to be working in those hours. And so that's part of the reason why there are costs in the juvenile justice system, because of things that happen in those time periods. So and the nurturing is still needed all the way through. So that's one. The other thing is that in my mind there are two pieces to the cost discussion. One is to be clear about what it really costs, and to say, if we're going to do a good job at this, this is what we need, without apology. If we recognize this is important, we say, this is what's needed. Then there's a separate discussion about how we pay for it. And that's very complicated, except that people answer that all the time when you're running a business, a nonprofit, any organization. How are we going to pay for this? And you get good minds around the table and you figure it out. And we've already heard that there are other models. So we don't have to reinvent the wheel. What we have to do is establish this as a priority, because we are paying for lots of things. And I may not agree with all the places where the tax money goes, but it's going there. So I feel that it's our responsibility to be clear about the priority, to take care of our kids, and to make sure that the burden does not fall unfairly on any particular group. So I hear Dan as a taxpayer, because I'm a taxpayer too. And we have to recognize that this has to be something shared fairly. So look at the models out there, leave it to good minds to figure it out, but make it a priority.
And that's a great point. The discussion of what's it cost and how to pay for it are distinct, related clearly. And one of the things I was telling somebody earlier is right now, one of the things in front of the commission is what's the model for how to cost out quality care. There are different models. We're in the process of choosing one. So hopefully, nothing's perfect, but I think that will be helpful in at least answering that part of the question, which might be easier than how to pay for it. So, but thank you for that distinction. Does anybody else have any last thoughts, things they want to make sure of other people here?
I'm Deb Whitkus. I'm a former early childhood educator. When you come to discuss the real cost, I'd have to say if you want early childhood education, quality education, you have to pay your teachers well. I left the field. I was very passionate about it, still very passionate about it, and I had to leave because I could no longer take the vow of poverty. Right now, the subsidy of the early child care programs that exist nationwide are on the backs of hard-working, poor women, most of them, and it's not acceptable. We have to not just raise up the field, but raise up the teacher salaries as well.
There is information about the Blue Ribbon Commission on the Building Bright Futures website, buildingbrightfutures.org/Blue Ribbon Commission, something like that. Once you get there, you should be able to get there. I'm sure I have it in front of me somewhere. And then I think, as I mentioned earlier, there'll be a survey, an online survey. So if you're interested in receiving that, I think if you've signed in and given an email address, you'll probably get that survey. Certainly, the Blue Ribbon Commission meetings are open. They are the third Thursday of the month from 10 to 12 in Montpelier. Not the most accessible meetings maybe on the planet, but I call in actually sometimes, so I can't imagine why a member of the public couldn't call in if you wanted to. So I think there are lots of ways to weigh in. This is not the only chance for your voice to be heard. And I I think sometimes people come to community forums and think, oh, this doesn't matter. I have to say I really believe it matters, which is a part of why when we said, as a commission, we were doing community forums, I said, look, I want to do it in Brattleboro because I think this is I think this feedback will really be meaningful and get to where it needs to go. So I feel strongly that this is not just, oh, we asked the question, we did what we had to do, check. I think this is a really meaningful exchange. Also mentioned the Vermont Early Childhood Alliance as another advocacy organization to get involved with, and I'm not sure of that exact web address, but it's another place to get involved and get information. And I've said to many of you probably, the early childhood world is full of players right now. What's Building Bright Futures? What's Let's Grow Kids? And I think I would offer that hopefully we're moving to a place where there's no wrong door. So if you enter in through the Let's Grow Kids door, hopefully you're connected to Building Bright Futures and other entities so that you can have access to all the information. So I know it's a little confusing, and I think we're getting more to a place where we're all concerned about early childhood. So come in through whatever door and get involved as you're interested in whatever way, both weighing in on what's challenging about this as well as where we want to go. So thank you, Vicki. Any other resources people want to mention? All right. Thank you so much for coming. I think it's been really fun. There's still some more snacks. Chocolate chip cookies are amazing. So thank you for being here.